Don't get that on me. My name is Liziana. I'm from Brazil, but I live in Las Vegas for the past 10 years. And I almost died doing plastic surgery. I consider myself a sub-celebrity. When you're not like A-list celebrity, but people know who you are. So all my surgeries and everything like about me is all over the news. After 6 surgeries, I hate the way that my nose looks and my nostrils are not even.
Why you wanna fix your nose? It's like it's almost perfect.
No, it's not.
It's all on your mind.
Plastic surgery in Brazil, people start young, like 16, 17. My first procedure, I was 70 years old, and I had a liposuction and breast implant. I've been like so many procedures, botox, cheek fillers, lip lift, lip fillers, breast implant twice, butt injections, and lipo all over my body. For my first nose job, I want, like cute little nose like Angelina Jolie. I end up, after the surgery, my nostrils not even. So I was doing more nose jobs because I have the idea, in one of these surgeries, I'm gonna have my nose fixed. If I wanna do like video or something like this, that is disgusting. So my 6th nose job, I went to Turkey till I have my nose fixed and to have a liposuction. And then a disaster happened. I went to the surgery, and when I woke up, I couldn't breathe. I was like, as I couldn't breathe, I went to coma because I had blood clot on my lungs. And I just remember waking up 5 days after.
As your friend, I'm gonna tell you, you gotta stop.
After I almost died, I waited for like 1 year to do another procedure. I'm gonna do whatever I want to. Like, it's my money, it's my body. And I went to Brazil to do some botox and fillers. And after 2 weeks, my lips was getting bigger and my face was like a huge ball on the side. That was worse for me than what happened in Turkey. I know you guys gonna say this is crazy, but if I die, just die. What if I have to live with my face forever like that? I went to the hospital, I couldn't feel my lips. And then I started to take steroids to put my face back to normal. Okay, I needed some pictures for my Instagram. I want Dr. Nassif to please make my nostril even. No, don't go for down. If you're going down, you're gonna see my nostril. I almost died, but I don't care. And till I have my nose fixed, I'm not gonna stop. And if the Dr. Nassif wants, maybe take some ribs out.
So our next patient, Liziana, something about helping her with her nose. Here she is.
Wow, looks like multiple nasal surgeries.
Yeah, she's had a lot of nasal surgery. Yeah, she's a
brow surgery.
Plastic surgery aficionado. Can you please send in Liziana?
Hi.
Liziana, nice to meet you.
Lizian, she's obsessive for plastic surgery, and it's get me worried because she almost died last year. I hope the doctor's gonna help Lizian to understand it's time to stop.
So we looked at your photos, and we know that you like plastic surgery.
Yes.
And I know that you're here for something with your nose.
Yes, and I have like, from now I have 6 nose jobs.
6, okay.
And I still hate my nose.
What don't you like about your nose?
Here, the nostril, that looks different.
So what plastic surgery have you had total?
Oh my gosh. I don't know. I lost count. There's been so many procedures, I lost count.
How many lipos? 10?
Can I say 20?
Okay, 20 lipos.
Yeah.
I think that's a record, isn't it?
Where did you have liposuction? What part of your body?
Oh, everything.
Really?
How did that go?
The lipos well, but the problem is I got addicted in doing liposuction. So if I see some fat on my body, lipo.
How much do you think you've spent up to this point in plastic surgery?
I could have drive a Ferrari if I don't have all these procedures done.
The other option is you could have a lot of plastic surgery and buy a Ferrari, like him.
Actually, Terry, it's a Ferrari. Ferrari. Engine sounds sweet.
I don't want to do lipo anymore, but
Good.
I wish I could remove my ribs. I think if I remove this here,
first of all, I'm not looking at your rib.
But if I remove here, I'm gonna look more. They think that I'm a little bit cuckoo, but it is what it is.
She's talking about a lift, she's talking about a new nose job.
So it's not going to stop.
She's not going to stop.
Have you ever had any complications?
I met this doctor in Turkey
What'd you go to Turkey for?
for a lipo and nose job because any doctors in USA wants to do lipo.
They won't do lipo.
No. And I went in coma.
What? You went into a coma? Why?
He said that I have embolism.
Pulmonary.
Embolism?
Yeah.
Wow. A pulmonary embolus
Yeah.
is when you have either a clot, a blood clot, go into your lungs and block your lungs and give you shortness of breath. Did he tell you where it came from?
Pulmonary embolism comes from one of the veins, usually in the lower extremities, that goes up into the right side of the heart and then enters into your lung and causes a big problem with your lung. Most of the people that I know that have had pulmonary embolisms aren't here with us anymore. Did the doctor say you almost died?
Yeah.
And you want more. What's wrong with this picture?
All right, let's go. Let me look at your nose. Okay, so very, very thin. Let me look at your ears. Okay, so cartilage has been removed from here. Well, that's not good. Any filler near your face?
Oh, yeah.
Yeah. And does that hurt with me touching you here?
Yeah, I have some infection, something there.
So you might still have something in there.
Look at even
Yeah, look
the
at that
lots
when I
of
do that.
clot come out.
Yeah.
It's
Oh,
right
wait a
there.
minute. Look
It's
at.
coming out.
Hold on 1 second. Let me just see.
There it is.
Okay.
There. Oh, look at that. More.
This is not hyaluronic acid, I don't think. It's kind of granular.
Oh my gosh.
Get it all out.
Oh my
This is so good.
Dr. Pimple Popper, eat your heart out.
That yellow stuffing coming out from Liziani's face was very disgusting. It's make me want to throw up.
That's some kind of a filler that your body doesn't like.
You've never had anything injected in the nose, right?
Yes.
You have.
You have some of that yellow junk filler, whatever it is, in your nose, too.
Yeah.
Okay. All right, your 2 nostrils. What I would have to do is add tissue from your ear made out of skin and cartilage on your right side. We make it a little bit better, a little bit wider, but to get that round curve, you can't recreate that again. 2, they took all the cartilage that I can use in your ear. If I do it, it could collapse your ear canal, and then you won't be able to hear well. The third thing is you have all this filler in your face. Whether you're infected or not, we're not sure, especially because of the drain. Most important thing when you go back to Vegas, have that looked at, maybe cultured, maybe put on antibiotics and watch it.
So even if all of these things could be fixed, there's one huge issue. You still had a major complication because that pulmonary embolus is no joke. And you will find other plastic surgeons who will want to do this. Don't do it, because you're gambling a game you're not going to win. You're going to lose your life. Do not do any more plastic surgery. I can't say that more emphatically. Are you going to listen to us?
Me and the doctors, we are in the same page for sure. Like, we think the same way, but to be honest, I don't think Lizian is gonna take the doctor's advice.
For my nose, maybe, but do you understand how frustrated it is? Because I want to fix my nose.
Okay, will you make me one promise? If you do more surgery, whatever it is, will you make sure you go to a pulmonologist, hematologist, and figure out first what happened?
They'll see if there's scar in your lung,
Yeah.
they'll see things.
Is there anything I can do to minimize the chance of it happening again? Will you do that?
Yeah.
Promise?
Yes. I'm pretty appreciative what doctor told me. Nice to meet you. Bye. But, sorry, doctors, but I'm not gonna stop doing surgeries. I just want to cut it, to like get a, cut it, and then just do like this.
Stop, forget about it.